How often? Really how often, if you're brushing your teeth and like you said, you start seeing some of the signs, like you're bleeding a little bit or some of that kind of stuff, doing some research on finding a good hygienist and clinic that will diagnose and help you identify it. But once you find that clinic and you go in, how often really should you, at least if you're at the beginning stages of periodontal disease, how often should you go to that hygienist?
Well, that depends, as you said, in the stages of periodontal disease that you are.
Right.
If you are in the gingivitis stage, that means that you have inflammation of the gums, but you don't have or you haven't had any bone loss at that point, right? So it's just a little bit of swelling of the gums, some bleeding, and that is the first stages of this gum disease process. If you're in that category, if you do typically a 6-month protocol of visiting your hygienist or your dentist, I think that's more than enough, as long as you are a good compliant patient at home doing the oral care and what you're supposed to. If you do neglect, then up when you visit to the dentist, so that way you can get more often to professionally get them clean. When you are in the middle stages or the later stages of periodontal disease, we have a different categories of stage 1, 2, 3, and 4, right? And each stage is characterized by a certain degree of level of bone loss and other findings. If you are in any of those stages, and for the viewers, general population, if they go to the doctor or the hygienist, the dentist or the hygienist, the dentist starts doing, or the hygienist starts probing around and they count some numbers, 2, 3, 2, 2, 3, 2, and then they will call a number is 5 or 4 or 6 or 7. When they call in those numbers, they are measuring that space, right, between the gum and the bone. So the deeper the number, the worse it is. So what that means for our patients, if you already have those higher numbers and you are in the category of periodontal disease establishment, then you get the first intervention as dictated by your clinician. It could be something called scaling and root planning, which is with instruments going inside the gum, your gum, and debride all that bacteria out of the inside part of the gum as much as you can. If you are in that category, how often should you see your hygienist for maintenance? Every 3 months.
Okay.
Because the studies shown that at 3 months, the bacteria gets back to the same levels with good maintenance, at the same levels that they were prior to the initial therapy.
Really?
Now, the problem is not only doesn't stop there, right? Because you say, okay, I got my scaling and root planning, my deeper cleaning or therapeutic cleaning. I'm good, I'm safe, I just come every 3 months and happy-go-lucky. The reality is not. There has to be a reevaluation after minimum of 6 weeks after that time, where the clinician, again, the dentist or the hygienist, or at this point, the periodontist, will intervene and say, if those probing depths or those pockets are still deep and you still have 5 millimeters or greater, then we have to do a surgical intervention to minimize those pockets and to remove the rest of the disease from the bone area inside the gums. So it is a surgical intervention. It's not very big surgery. Nevertheless, it's an intervention that is required to minimize the bacteria. And regardless if you have obtained clinical health levels because your pockets decrease to a maintainable levels of 2 and 3 millimeters of the depth of the pocket after the initial therapeutic cleaning, great. Every 3 months, maintenance protocol. If your pockets did not decrease, then we as periodontists, we intervene and we help them decrease that pocket so you can have better access to keep it clean. And also every 3 months, you have to come back and get your regular maintenance.